Hello, welcome everyone. My name is Cassy Gibson, and I'm the co-founder and director of product design for Kliit Health, on-demand sexual and reproductive health answers from real experts. So I'd like to start today, like many of my friends and founders did, by introducing you to a person named Angie. Angie is a young woman, an immigrant attending university in America in a large metropolitan city. Angie's recently become sexually active, she's 18 years of age, and one day she begins to experience pain in her abdominal region. So how many of us in Angie's position would go online and Google our symptoms? Yeah, okay, that's like most of us, right? That's pretty common. And Angie does that. So Angie goes online, she hops on her computer and begins the process of online self-diagnosis and self-treatment. But this process puts Angie at risk for emergency medical events and subsequently the high burden of emergency room bills. So Angie's story is actually the story of Kliit co-founder and CEO Crystal, whose online search led her to believe that a serious condition was simply period cramps. So Crystal and Angie are not unlike many women in America. In fact, women are more likely than men to search online for health information. And young people are more likely to search online for health information than our senior citizens. So why are young women driven to the internet for their health information? Well, the fact of the matter is there are a lot of barriers to care, right? And those are inconvenience, a high price, and distance from care. And for the sexual and reproductive health area, there's also an associated stigma with seeking care. For multicultural women like Angie and Crystal, there's often a lack of cultural competency among providers, which kind of alienates patients from doctors who don't look or think like them. So we have a large population of underinsured, undertreated women, and Dr. Google doesn't replace a care team for them, so they're at increased risk for STIs, unplanned pregnancy, and maternal mortality. That's why we created Kliit. Kliit is a digital health platform where users can talk to trusted OBGYNs, nurses, and sex therapists about their health, instead of relying on Google to answer their most intimate questions. We're looking to reduce the self-diagnosis rate from online searches by providing access to resources that are affordable, convenient, and inclusive. These pillars of affordability, convenience, and inclusivity position us particularly to reach the undertreated and underinsured populations that suffer the most from a lack of reproductive health care. The user experience is simple. For a set number of credits that cost less than the average copay, users can ask questions when they want to, not just during business hours. They can select from a list of our trusted experts, filtering for things like specialty, language, and gender, and then begin a secure thread of chatting with the provider of their choosing. Kliit follows a pay-per-play model in which users pay around $15 per conversation. We also plan to incorporate a subscription-based model where users can save on multiple conversations throughout the year or throughout a few months. The market opportunity in this space is huge. The total population of or underinsured women in America is around 30 million. Those 30 million women are spending about $300 annually on sexual and reproductive health care, making this a $9.6 billion market opportunity annually. Our competitive landscape is kind of interesting. So we have things like Tia Health and Maven Health. Those are actually clinics. So we stand out among the competition in our convenience and affordability. And you might say, well, how can you keep the costs low? Well, conversations, by incorporating chat, we're keeping the provider time required per conversation down to about 20% of what's required for an in-person consultation, and providers can manage multiple threads at a time. But chatting isn't all that's in store for us. We hope to incorporate things like a health diary so that users can earn credits, and video chatting so that we can create a comprehensive care ecosystem. Right now, we're working on our beta launch. We are launching in early November, the 1st of November, with our partner Trinity Medical Care in New York City to provide free answers to our first 1,400 app waitlist members. And the CEO and founder of Trinity Medical Care has also joined our team as the Chief Medical Officer. The rest of our team has experience in healthcare, business, and technology. Our trusted advisors are really experienced in the healthcare space, and we'd like to add to that a list of trusted investors. which is why I present a $500,000 investment opportunity so we can reach our next milestones, get through beta test, validate our assumptions, and move forward. Thank you.
So first, you scare me a little bit because I'm afraid you're going to go off the edge of the stage.
Sorry, I just took up the whole slide.
Just didn't want you falling, no.
Yeah.
So as you're putting this platform together, there's a lot of platforms that offer healthcare online. How are you really differentiating yourself in that space? You know, the chat is something that's already in play. Where is your real differentiation?
Yeah, so that's a really good question, and it's a conversation we've had with a lot of insurers and hospital systems. And when we talk to them, they say, you know, we've contracted with this telehealth company, and people are kind of using it, but they're not using it at the rate we'd like. And the people who are using it are not these people, right? They're not young women. Oftentimes, the younger population kind of steers away from telehealth because it's also wrapped up in insurance. So by targeting the underinsured and uninsured population, we're hitting people where they maybe have a sex question and they're afraid to ask their parents if they have it covered by health insurance, or they're afraid to go to the clinic at school. So this is a slightly different market, and it's also hitting it more particularly as opposed to a broader blanket.
So how are you reaching those young women that want to find things out or get onto the platform?
Yeah, so we currently have over 3,000 social media followers, and we have an online community that's active with 10 sexual and reproductive health wellness topics in a forum style. So the internet presence is there, but there's also a lot of partnerships that we're looking for within health systems, insurers, and even universities. So there's a lot of opportunity there to partner and reach markets more targeted.
So was the subscription prices for the individual user, or are your partnerships covering the cost for the individual access to your?
So right now we're hypothesizing that the individual can pay and will pay for some portion of conversations. That doesn't close us off from the opportunity for partnerships, where an insurance provider might say, you know, somebody in our coverage can have the premium membership, it's part of their package, whatever it may be.
And then can you share how the credits work?
Yeah, so we are doing a credit-based model simply because, well, for one, kind of using credits as a currency as opposed to putting a dollar sign in the currency makes users feel more comfortable and less aware of, you know, like, oh, I'm spending $15 right now. Like, I've already purchased the subscription that lets me talk to a doctor as much as I want. Secondly, the credits are structured in such a way that when we do ramp up to bigger services like video chat and like having a specialist, like having your records integrated, there are things that will cost more. So we're creating kind of an in-platform currency to allow for that. Sorry.